Montgomery County leaders recently took urgent action in response to federal funding cuts that disrupted essential health and human services across the county. At a press conference in Silver Spring, Councilmember Sayles announced a proposal aimed at stabilizing services for seniors, families, and vulnerable residents.
I just want to remind us about the egregious cuts to federal funding that's directly harming our seniors and vulnerable residents here in Montgomery County. These reductions in local services and support are unacceptable.
As chair of the Council's Health and Human Services Committee, Councilmember Sayles proposed a $1 million special appropriation to the county's fiscal year 2026 operating budget. The move came after federal and state funding cuts forced service pauses, intake closures, and rapidly growing wait lists, putting residents at risk of losing access to critical support.
After being appointed chair of the Health and Human Services Committee on December 9th, I took immediate action by touring our Department of Health and Human Services. What I observed was a dedicated workforce doing everything they can to protect residents while facing overwhelming challenges, reduced federal support, rising costs, and escalating demands for services. The situation is unsustainable and the consequences are clear. Programs that allow seniors to age in place with dignity are being dismantled. Intake programs are shutting down, wait lists are skyrocketing, and families are being pushed to the brink.
And we've always said that Montgomery County should be a place where you can age with dignity. We're proud of being an age-friendly county, and you get to be age-friendly by actually caring about and working for the things that our seniors need. And you can't have dignity if you don't have food security, and you can't have a healthy community if your family caregivers are burning out.
The proposed earmark for the senior nutrition program will mean that many of our older neighbors will not have to choose between eating and other necessities.
We will see gaps in services. So this funding is appropriate, it's immediate, and it will help along our continuum of care.
If approved, the funding would be immediately transferred to the Department of Health and Human Services to prevent further disruptions and keep essential programs operating.
The $1 million special appropriation delivers immediate intervention in three critical areas. First, $450,000 will be dedicated to senior nutrition to reopen access to these meals. Second, $300,000 for home care services to reduce wait lists. And third, $250,000 for respite care to provide thousands of hours of essential support to families who urgently need it.
Councilmember Sayles said the appropriation was designed to stop immediate harm while the county works toward long-term solutions.
This emergency appropriation is our response, and it sends a clear message. Aging in place with dignity is not a luxury. In Montgomery County, it is a promise that we keep.
The resolution was co-led by Council President Natalie Fanny Gonzalez, along with Council members Sidney Katz, Kristen Mink, and Will Joando, underscoring broad Council support for the proposal. The resolution was formally introduced when the Council reconvened after winter recess. A public hearing is scheduled for January 27th, followed by a joint committee work session with the Government Operations and Fiscal Policy and the Health and Human Services Committees on Monday, February 9th. Reporting in Silver Spring, I'm Marshai Sahalu.